Greetings, my name is Omar Esponda, and it is an honor to present this short lecture here at Vicom, although electronically. In my opinion, there is no ideal vein center, but there are exceptional ones. What distinguishes them is the clinical and technical expertise of their operator. Some comprehensive vein centers manage a wide spectrum of disease, from arteriovenous malformations to sclerotherapy. Others maintain a narrower scope, reflecting the expertise of their clinicians. Both models can be valid. What matters is alignment between capability and care delivery. An exceptional vein center balances patient-centered care, operational efficiency, and strict adherence to evidence-based practice. Meanwhile, the clinical medical director and administration manage policies and direct personnel, ensuring clear communication, regulatory compliance, and adherence to accreditation and quality improvement standards. Clinical stakeholders base decisions on society guidelines and validated recommendations. For example, they follow evidence-based protocols such as performing diagnostic reflex studies in the upright position. Leadership, in turn, builds systems that define, measure, analyze, control, and improve processes. Administrators examine these processes to enhance patient access to care by tracking visits, reviewing appointment statistics, and identifying factors that lead to appointment cancellations. These systems must be transparent, tracked, and reviewed in real time, so data are usable not retrospectively. The process is fully transparent, with all stakeholders accessing the same information to identify access barrier, improve care delivery, and enhance patient engagement. Key performance indicators, patient satisfaction, engagement, outcomes, and referral patterns are shared regularly with the care team and with clinical and management stakeholders. This feedback loop reinforces strengths and identifies gaps. Communication is central. Daily case discussions, peer collaboration, and integrated care models prevent clinical isolation. Nursing encounters are standardized and aligned with procedural and recovery expectations. Administrative workflows should ensure timely authorization for required interventions and avoid treatment delays. Once a patient enters the center, care follows a structured pathway. The patient journey at the vein center begins with an initial consultation and evaluation, followed by treatment planning, intervention, post-treatment monitoring, and follow-up. The initial visits focus a history and physical examination supported by a clinical classification and scoring symptoms, which is followed then by ultrasound evaluation. The duplex ultrasound confirms the diagnosis and generates a vein map that documents anatomy and reflex patterns. This snapshot provides a concise, detailed assessment of superficial venous insufficiency. Treatment planning emphasizes education and shared decision making, setting clear patient expectations through education about viable treatment options. Interventions are driven by medical necessity and guided by written protocols. During the intervention phase, standardized written protocols for conservative, minimally invasive, and surgical therapies are used to enhance safety and efficiency. These written protocols reduce errors, ensure quality of care, and meet safety and regulatory standards, while education staff improve quality and efficiency and minimize liability through risk management. In short, these protocols reduce variability, improve safety, ensure regulatory compliance, and mitigate risk. Post-treatment care follows the same pathway. Classification and scoring tools are revisited to guide follow up and ongoing management, where surveillance is scheduled at appropriate intervals, recognizing the chronic nature of venous disease, and long term treatment strategies are tailored to each patient's need. Exceptional centers also invest their people in ongoing training, which keeps technical staff proficient in a rapidly evolving field. One example is Vane University Global, a teaching network of physicians focused on venous disease. Through its educational program and YouTube channel, clinicians from around the world share practical knowledge and discuss current topics in phlebology. Digital tools such as AI assisted documentation improve efficiency. Advances in imaging, including high resolution duplex ultrasound, can reveal anatomy that would otherwise be missed. There is no single ideal vein center, but exceptional ones share three attributes: patient care, operational excellence, and a commitment to continuous improvement. The goal is not perfection, it's consistency and clarity progress.